Hey everyone, get ready for another amazing The Heart of Innovation broadcast. We have Joshua producing from YouTube, and we have the Christy in the San Francisco studio helping us to broadcast live on KDOW. So stay with us.
8097 800-432-8097. That's 800-432-8097.
KDOW, Palo Alto. Streaming at KDOW.biz. On our mobile app, iHeart, TuneIn, and the Odyssey app. If you can't find us wherever you go, you're just not trying. AM 1220 KDOW.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation, 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Well, hello everyone. Welcome to The Heart of Innovation. You know, some people practice medicine because it's their job. Others do it because it's in their blood. It's who they are at their core. And when life changes the path, that calling does not disappear. It just finds another way forward. And today's episode is all about that kind of medicine. And I can't wait to introduce you all to Dr. Chen. She's a retired podiatrist turned diabetic educator, and her story is remarkable, and you're going to be inspired by her journey, especially as she shares the life-altering moment that led to a career shift and become mission-driven. I'm here, of course, as always, with Dr. John Phillips. Dr. John, this is really one of those stories, I think, that reminds us that medicine isn't just a specialty, it's truly an instinct. And I think you demonstrated that just a few weeks ago when you shared a very personal story of that instinct, which drove you to actually save a life of a man in Ohio. And I don't know, for those who
Yeah,
missed it, you might want to give us the Cliff Notes version because it was so powerful.
yeah. I mean, happy Saturday, Kimberly. Your hair looks great, by the way. I love it. Remember, because you were a little worried about during the cruise, right? It looks awesome.
Yeah, I just got back from the cruise. I didn't know there was literally a hair Olympics, and this
Yes.
guy from India won the World Hair Olympics. But initially, he died, didn't have enough time, and my hair was orange, so we had to go back for take two.
Right, and it looks fantastic. Mine
Thank
is
you.
covered with a hat from a town in Maui, which you were just
Yeah, keep it on.
Yeah, definitely. I'll keep it on. Don't worry. Yeah, no, looking forward to the show because Dr. Chen's story is obviously very powerful, but it's not often we have the physician that's a patient too. And so, you're kind of straddling that line of she knows enough to be dangerous, but yet she has some of the risk factors for what we talk about all the time with peripheral arterial disease. So that's going to be an awesome conversation, and I'm really looking forward to it. But yeah, the story that I shared a little bit, it was one of those moments, and I'm sure Dr. Chen's had them, where we find ourselves as physicians in situations where you have to make a decision and you're not sure
Yeah.
what the right decision is, and you just kind of go with your gut. And my gut was telling me to do something, and at the end of the day, it worked out really well, and it was kind of a Christmas miracle. So I'm really happy for that patient. Obviously, the family's happy, and I'm just glad that the team was everybody was pulling the rope in the same direction that day, and it worked out well for the patient.
And he had a heart attack. You were able to bring him back, open up his arteries. And how is he doing today?
Yeah, so I actually was looking at his chart yesterday. I think he might be home from the rehab place. So he was discharged from our hospital to a rehab facility, and I think he's home. But again, when I saw the patient, I'm not going to make light of this, but Princess Bride,
Yes.
where there's that scene where he's like partially dead, and I think they're blowing air into his mouth. This was like the most dead I've ever seen anybody, if that makes any sense. And so it was just, again, something that I will always remember, and it does. It comes into my, like, that situation comes into my mind pretty frequently when I'm dealing with sick patients. So it was a life changer for me, for sure.
Which drives home exactly what I said leading into this, which was it's really about that instinct, right?
Yep.
Medicine requires that kind of instinct that led you to save this man's life.
Yeah, and again, if I would have done something, who knows what if whatever, I don't know. I told the gentleman when he woke up, I said, I'm not pushing my religion on you, but I'm just saying, like, I think God has a plan for you, and you need to do something in this life now, and you need to pay this forward. And he totally got that. So hopefully there's something, he's got great things ahead of him, hopefully.
Well, we appreciate you. And for those who haven't seen that story, you have to go to youtube.com/the @ the way to my heart and click under the live tab, because you really don't want to miss that story. It is so powerful. And it's under the one where we talk about travel tips on Princess Cruise Lines. And we ended up deviating from that
Yes.
conversation to something a lot more powerful and impactful.
And
So
I think what I'd like, when I see him in follow up, maybe we'll get him on the show and he can be a Save My Piggies guest. So that would be kind of cool.
I would love that. So let's get to Dr. Chen's story, another story filled with instinct driven medicine. But first, a moment of inspiration.
Dr. John Phillips' spectacular vascular moment of inspiration.
I always look to see how the guests respond to the noise that makes, and Jane's smiling. So I'm going to say my little.
It's my favorite part.
I know, mine too. It just
Doesn't
makes me
get
laugh
old.
like I swear I have the mentality of like a 15-year-old. But at any rate, so this is a quote from Marcus Aurelius. He's one of the most famous Stoic philosophers. I've quoted him before, and I was I was preparing for the quote in the context of Gene's story, or Dr. Chen's story, kind of dealing with having risk factors of diabetes and also being, a podiatrist, so a healer. And I found this from Marcus Aurelius because I think it focuses on what you can control. And so he's quoted as saying, "You have power over your mind, not outside events. Realize this and you will find strength." Marcus Aurelius.
That's really empowering. It's also a little scary, because it actually states that you are in control of your body. And sometimes when you have these things happen, with illness or accidents that we'll hear about, you feel out of control. But the key is, in order to maintain a long-term mental state that is healthy. I mean, it's mental wellness awareness month. You've got to take that control back. You've got to believe that your mind can control how you feel and who you are and what happens to you going forward, right?
And it's similar to when you did the movie, you had the hypnotic that was
Oh yeah, the
real, right?
hypnosis for our New Year's resolution show.
Resolution show, yeah. So
I did have someone who ended up calling into our Leg Saver hotline at 1-833-PAD legs and said they watched the show and they used that hypnosis to say, I'm in control of my body. I decide when to stop. And I thought that was so powerful that that moment that we had on that show led to someone walking further and faster and improving their circulation. So
awesome.
you never know what's going to resonate, right? And I hope that Dr. Jean Chen's story resonates. I can't wait to get started and bring her in. That's next right here on the Heart of Innovation on KDOW. Don't go away. Thank you, Josh. Okay. Why don't I just,
You want to bring her back?
yeah.
I would like to. Yes, I need to give a shout out to Issa and the Reflow Medical team, because I had a conversation with Issa yesterday, and I just want to thank him publicly
Oh,
for
good.
supporting us.
Yes. Well, you just did publicly right there. We're live on
I'll
YouTube. We're
publicly it
live on
again.
Facebook. Yeah, and maybe in the third segment,
Sure. You
you'll
refresh
bring us
my
back.
memory. Yes. Yes.
Yeah, I will. Because then you can bring us back because it says it does the full introduction, and you can say, of course, this is brought to you by,
Gotcha.
Reflow. And
Yes.
I just love them. I had a great conversation with Gunter, who is with them
Mhm.
just this week as well. He is taking he's doing an interview. If you remember, we had Benny on and Dr. Salhanik on, and they had used
Yeah.
that new spur device on Benny, and Benny is doing great. It was another reminder that if you're having heart issues, and especially AFib or valvular issues, someone should check your legs, especially in his case, where he ended up with discoloration in his legs before he left the hospital. He had pressure wounds,
30 seconds.
discoloration in his leg, temperature changes, and he went home with blood clots in his legs. And it was, and he ended up thankfully meeting Dr. Salhanik, and Dr. Salhanik opened those arteries, and he's doing great.
Yeah, it's awesome.
So Gunter is going to be interviewing him during their sales meeting coming up.
Oh, cool.
We had a
The
great
Money
conversation
Pulse,
about
Business of the
Benny's
Week, 2
story.
p.m. Wednesday, 12:30 Saturday on AM
Okay.
1220 KDOW.
9 minutes,
AM
15
1220
seconds.
KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. I want to bring in Dr. Jean Chen and really get started with her story. She grew up in Taiwan watching her parents care for patients as an act of service long before she wore a white coat. And she trained as a podiatrist ultimately when she came over to the States because she had a passion for limb preservation. And I'm excited for her to share how she decided on becoming a podiatrist. That's a great story. But also, I look forward to her sharing that life altering injury that really ended that chapter. And I'm going to tell you that sucked, but it turned out, being a blessing for her and so many patients that she is now helping as a diabetic educator. She found that other way to serve the community using both her training and her lived experience to help others protect their health. So, Jean, welcome. Thank you so much for being here. Appreciating you for sharing your story and all you do to help save life and limb.
Well, thank you for having me. I'm very honored to be here today.
Yes, we love having you. But I want to start from just with that instinct, because we touched so much on it in the first segment here, and where that began for you. What did medicine really mean in your family growing up in Taiwan?
Well, I grew up, my mother is a registered nurse, and my father was a pediatrician in Taiwan. They come from very poor family. And by the time I was 5 years old, I was very, very sure I want to be like my parents. I wanted to be a doctor. I wanted to help other people. Stories about my parents coming, after World War II. My parents' family went to Taiwan. My father's family went to Vietnam, and not being able to afford medications costed my grandfather on my father's side his life. And I never got to meet him. And how my father went to Taiwan, got a medical degree. And when I was watching him having his own private practice, I saw how he used his own money to treat those who couldn't afford it, because he and mom knows what it's like to be poor. And my father also volunteered after a devastating hurricane in Philippines for a whole entire month. And my mom did something similar too. And I felt medicine is a human right, and everyone deserves to be treated. It shouldn't be based on economic status or power. Everyone should be treated with humility and respect.
Yeah, and so your parents take us back to when your parents, brought you over from Taiwan to the United States and how their careers changed here. And ultimately, that ended up influencing you even further.
Well, I have a surprise for you, Kim.
Uh-oh.
Today is my 49 years coming to United States. Today is
Are
the
you
anniversary.
serious?
Yeah.
Oh,
Wow.
congratulations. We're so thankful to have you here.
I am
That's
so
amazing.
grateful. You have no idea how grateful I am to the United States government for letting us immigrate to United States. And it is such an incredible journey. We we came on a 747. It was Christmas time in 1976, and we got a letter saying we had to go to the U.S. Embassy. And I didn't know why my parents for a few months were playing records like ABC, and trying to make my sister and me learn our ABCs. And the funny story is, around Christmas, we went to the U.S. Embassy and we were interviewed. And my sister, she was younger. She's 3 years younger, so she's crawling across the desk,
No.
the officer who's
Oh, cute.
interviewing us. My mom's trying to hold on to her while she's trying to crawl. And the guy talked to my parents, and then he looked at me and he said, "How do you feel about going to United States?" And I started singing A B C D E F G, and then he just pointed at me like this: "You're going to United States." And
Love it.
and then in a few days later, we got a register letter saying you have to enter United States by January 10th, or you cannot come to United States anymore. And so my parents immediately start calling all their relatives, giving things away, converting what they can to American cash, to US dollars. They bought 8 large luggages. They put blankets, clothing, and plane tickets. We hopped on a 747, went through Hawaii to enter the US, and we landed at LA, and here we are.
I think that
How did they
story is more,
choose?
I mean, ho- not to, well, I'd love to get into that further, frankly, if you don't mind. I mean, so your dad gave up his practice in Taiwan. He can't practice in the US without completely starting over,
Right.
correct? So
Correct.
he did this for you guys,
Yeah.
right? I imagine. I mean, so your dad's a selfless, and your mom too. So he led by example, and you obviously carried that or continue to carry that torch as well. I mean, that's an amazing story, and man, that's inspiring. That's it, particularly in what's going on right now. That what we're hearing in the press, it's inspirational to hear somebody that did it through legal channels and has flourished for many
Yeah,
years.
how did your dad, your mom end up assimilating? I assume, as Dr. John says, that it just being a doctor and being a nurse, it just doesn't translate in a
No.
very simple sign a document type of way. What did your parents each have to go through, and how did their career paths potentially change in light of it?
Well, we lived in a hotel for a week until we found a 1 bedroom house that my parents rented. And my father initially tried to work in a restaurant, but that wasn't helping him to, have time to study, to become boarded and find a residency in the United States. So my mom at that time decided to work as a nurse's aide, and Toyota just came out with their first car. So we bought the tiny little Toyota, and mom went to work as a nurse's aide. My father stayed at home. Um,
How
he
old was your dad at the time?
I was 8 and a half, so I'm assuming my dad was probably like early 30s.
Sure. So I mean, but he has to go through a complete residency program again and basically start over. And it sounds
Yeah.
like he was willing to do that. Did he ultimately do that?
Yes, a year later, we moved to Euclid, Ohio. That's how I was telling you I grew up in Euclid. He actually found a general practitioner residency at Euclid General Hospital. And so he got his 2 years of training. And at that time, my mom was able to pass her nursing exam and continue to work as a nurse at Euclid General Hospital. So after that, my father, after coming out of residency, he decided he did not want to have his own private practice. He felt family is very important, so he also wanted to work with people who are differently abled. So he went to work for the state of Ohio to work with the differently able. And then at nighttime that he's at home watching over my sister and me growing up, because sometimes my mom worked double shift. So he wanted to make sure the family's well taken care of.
And coming up next, right here on the Heart of Innovation, we're going to talk a little bit about our mom who ended up in cardiovascular health and how Dr. Jean Chen ended up in podiatry and ultimately altered her career path to become a diabetic educator. That's next, right here on the Heart of Innovation on KDOW. Don't go away.
3 years ago,
I think we need literally 2 hours for this.
I know. I've been, you can't. I was listening to the Sean Ryan podcast. He interviewed the Black Hawk Down pilot, the helicopter pilot that went down in 1993, I think it was. Anyway, it's 4 hours long, 4.5, 5 hours long. And these guys sit there and they talk all day. Now, you don't need 4 hours, but clearly a lot of our stories need hour and a half, 2. I mean, Gene, I could listen to your story. I think that's so, like, it's such a firsthand account of what my kids take for granted. I take for granted. I think a lot of people take for granted living in this country. And, I don't hear too many people thanking the U.S. government these days. So kudos. Thanks for sharing that.
My pleasure.
You have
I
such an
love this
infectious
nation.
smile too. Gosh, love it.
I love this nation. I am so grateful for this nation.
I didn't want to ask you on the air, but I mean, I imagine when, like, people, at least the people that I know that have immigrated here legally, find it upsetting for those that come in illegally, because it takes a lot of work. You don't have to comment, but I think it goes without saying, frankly.
We could talk about it after we get off the air.
Indeed, we can the after show.
We can have a private after show.
Right.
That's so funny. So I know that and Joshua is hearting you both. That's a great little gif there. So Dr. John, you want to take us back? I would like to just mention, her mom was in
Talk
cardiovascular
about
health. I
mom,
don't know
sure.
if that has, but then, her plight to go into medical school and how she found podiatry is the stories.
Mm-hmm.
There are 2 major stories that came along with that. One, it's your foray into oncology and the actual experience there, Jean. And then the other part of it is when you discovered podiatry and limb salvage is really interesting. And then we can get into, and we have 6 minutes to do that in.
What? Only 6? Oh, geez.
I know Christy is not being very friendly right now. Christy, I'm just kidding.
Hey, he's got a job to do. He's got a job to do. Okay,
No,
cool.
we love Christy.
So that, man, we're already on segment 3.
30 seconds.
Okay.
I know exactly. Ay.
So we'll spend, Gene, maybe like 30 seconds on mom, and then we'll get into your story.
Okay.
Okay.
And remember you wanted to thank Reflow.
Oh, yes.
It's a friendly reminder.
Mm-hmm.
Okay. We're just waiting for the commercials to end. Here we go.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. I would be remiss if I did not thank Reflow Medical for sponsoring what I think is the best medical podcast in the world. So thank you, Reflow Medical. I had a great conversation with Issa, their CEO, yesterday. So if you see a Reflow medical employee on the streets, give him a hug for us. So
Yes,
anyway,
please.
yes. So Gene, let's continue your story real quick. Tell us a little bit about mom, because mom was involved as a nurse in cardiovascular care, but then we want to hear how, you grew up, went through education, ultimately got into the field of podiatry.
Well, mom is a coronary intensive care nurse. Well, she's retired now, but she really loved medicine. Unfortunately, when she's at Taiwan, she tested very high for medical school, but they said, "You're a woman. You can't be,
Oh,
yeah,
wow.
to be a
Back
nurse."
then, no
Back then,
way.
yeah. So
Oh,
she felt that coronary intensive care nursing would be very challenging. So she got into CICU, and thank God for mom for saving my life one day. But
did
uh,
she really? Wait, wait,
yeah.
wait. Don't brush over that. What happened there?
What happened there was
Oh,
that I was having angina and I was admitted to the hospital, and I've been in and out the emergency room multiple times, and I was seeing my cardiologist in New York, and he was trying to get prior authorization through Aetna to do some tests on me. But I texted him one night because he was my attending. So I was telling him, I think I should go to the emergency room. I've been long-term diabetic over 20 years at that time. And and I'm having nausea. I'm having some unusual chest pain, but it's not the typical pain that you talk about going down your left arm. But I just don't feel well. I'm vomiting. So he agreed with me, go to the ER. And at the ER, you know, being a woman, you really have to advocate for yourself because at first they just said, "Oh, it's probably acid reflux," and I said, "No, no, 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 no. I want a cardiology consult." And the cardiologist came. I told the whole story, and he admitted me for observation overnight. And I had on and off pain throughout the night, and they were ready to discharge me the following day. Um, but my mom came in and she talked to the doctor. She said, "You can't have her be in and out of the hospital all the time. Why don't you guys do the cardiac cath and really see what's going on?" And
How'd that go over? I can't
yeah.
imagine.
well,
Good for
they
her.
gave me a choice. They said, "Well, we could discharge you because if we do the cardiac cath at this hospital, um, if
They can't
there's a blockage, they couldn't
they
help
can't
me."
fix it. Yeah. Yeah.
Right.
Yeah.
So I said, "Well, why don't you transfer me to the hospital 1 mile down where you can actually do it, where it's a heart center, a Vassar Brothers Center, because they can do it. Why don't you transfer me?" So they arranged for the transfer, and it was really funny too. I'm still laughing about it because I I'm there, half nude from bottom down, waiting for the cardiac thoracic surgeon who was ready to do this, and he disappeared. He came in, he said hello, he disappeared, and then he came back in eating a sandwich. I'm thinking like, I'm hungry too. But he disappeared again. um,
How candid this is. That's amazing. I know so many patients that
Yeah.
are actually nodding right now going, yeah, exactly. Don't eat in front of the patient that's been literally fasting for 24 hours for this."
Now, but I always tell patients and their families, I'm like, listen, nobody's ever starved to death at our hospital, and you're not going to be the first one. But I get it. You get hangry. I get it. I get it. But that's a good note to self.
so mad about is just that I'm like, okay, can I get this over? Because I'm really scared. Because like for the first time in my life, laying there, I realized that if anything go wrong, I could possibly die on the spot, you know. And I know my diabetes. I've been struggling with getting the diabetes under control,
Yeah.
and and that was a scary moment because I don't know what will happen. And of course, they gave me the Valium, and the guy, when he came back in, he just said, "You'll be home tonight," and and then partway through, he just said, "You're not going home. You're gonna be staying overnight." And the next thing I
Oh,
knew is that a stent was placed into my widowmaker, and it was 80% occluded. So I'm so glad mom insisted on this because if I had a major heart attack, I don't know if I'm gonna still be here.
Yeah.
No, thank you to mom. Oh my goodness.
Thanks, Mom.
We always talk about, your family, and if you can't advocate, your family needs to step in and advocate. That's incredible. So here was you've had it for your diabetes for 20 years. When you were younger, did you have any sort of medical issues that influenced your decision to go into medicine as well and influence how you end up treating patients? I can imagine now as a diabetes educator that your experience definitely influences your care.
My father, he was a diabetic. My grandfather on the maternal side and my mother, they're diabetics. And so um, definitely that has influenced me a lot. And another thing that really influenced me is what happened to me in college. When I was at Cornell, I took a year off. Um, During that time, I worked at Tompkins Community Hospital and I was on the surgical oncology floor. When the patients came back from her surgery, she
And you don't want to miss what happened next. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. Cliffhanger.
Yeah, Gene,
I
we
got
call that
that one.
we call that a cliffhanger or a
Beat you on
tease
that
in
one.
the business. Yeah, the business in the business.
that was fun.
Gene, I do want to ask you, obviously we have to get into how you got into podiatry, but I've never asked, and maybe we do this offline too, but I've never asked a patient like what they're thinking before they undergo the catheterization, because you verbalized it in the sense that you recognize that something could go sideways, and you could potentially be in trouble. And I think that would be, if you don't mind, powerful to our listeners, because a lot of them have procedures. There's certain anxiety and they're scared for these things. And I think it really humanizes what we do when we have someone, you have a medical background, you know exactly what could happen. But we don't talk about that really. And I would love for you to share that some more if you don't mind.
Yeah,
Sure.
especially since it is Mental Wellness Awareness Month, it's a really good time
Yeah.
to have a grander discussion about that.
Absolutely.
But we do have to get back to your cliffhanger, though.
Okay.
Yeah, I mean, we could do that if Dr. John has a little bit of extra time afterwards. I was even thinking that we could do a short segment maybe on that being Mental Wellness Awareness Month and just focusing on that. But number two is we could do a quick segment on the new food guidelines.
Sure. Yeah, I just have a 4 o'clock stop my time.
He's got to watch the Packers game tonight.
No, I have to make dinner. Well, yeah, I've got to get our dinner
Wait
prepped.
a minute. Wait a minute. Dr. John is cooking?
Well, you make
Well, it's in a crock pot. I'm helping my mother frequently, so this isn't. I do
Aw.
cook actually, but I'm helping. She lost power in our house, so that she's over here with this dog that doesn't stop barking, which I was wondering if you guys could hear. That was part of my
Nope.
problem.
nope.
No, these microphones, there were a lot of times my dogs were barking and
You don't
you
hear
guys
anything.
didn't.
This is amazing.
No, these microphones are so awesome. But it's literally, I mean, this thing is massive.
No, I know. Yeah.
Wow.
I know. He and I have matching mics. Isn't that cute?
Sometimes you used to have one that it was a handheld, right?
I did. And I also had a blue one that was a lot
Yes.
smaller.
Yeah.
And the smaller one, dropping it on my toe wasn't as big of a deal as
But now I
this one.
see podcasters, they wear like it's like a square clip. I see people wearing
Yeah.
those.
And I
I
have
feel like we
those
should have
too.
headphones too. Everybody has headphones. I feel like I should put some headphones on to
Oh, ask
more look
ask
cool.
Joshua what he thinks
He's
about
not a
that.
headphone guy. No headphones, nerd. I don't know though, man. Like everybody's got them.
He said no headphones, nerd.
Hey man, I'm just trying to fit in, dude.
The thing is, I watched Joshua in these aortic hope because he's also with aortic hope. We should get Dr. John on aortic hope on their channel for a Q&A. That would be really fun.
Happy to help.
In all his spare time. but he always jumps in, and you can hear him jump in. And I want him jumping into ours too because he's funny. He's really funny. He
It
makes
is.
me laugh.
It's
His
yes.
comments are hilarious.
It's weird because on occasion, like if you listen to a podcast regularly or a radio show, every once in a while the producer will chime in and they don't say much ever, but when they do, it is very like poignant and like uh, directed, and then so it carries a lot of weight. What is it? Speak less, listen more, whatever. So, how much time do we have in this next one? 9:40.
9 minutes. We
Okay.
have 9:40.
Okay.
I did a short commercial in
Oh,
there.
good.
But I was missing Chris D's voice in our show, so I had to get him. I was gonna skip doing a commercial this week, and then I was like, I like Chris D's voice, so I got him a commercial to do.
Nice. Then Joshua says Zoom and Teams have noise canceling software too, so that must.
That's
30 seconds.
see, doesn't Chris D have the sexiest voice?
I mean,
Saying.
I think it's a voice that is well fit for radio.
Can you see him blushing through the darkness?
Yeah.
Trump wasn't clear in a social media post Friday night whether a cap
Thank you,
might
Christy.
take effect through executive action or legislation.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. We are live on KDOW and streaming on YouTube. You know what? We've got so much to talk about in very little time here. So the cliffhanger before we went to break, Gene, you were telling us about being at Cornell, so got into a fantastic school, obviously very smart, and you're taking a year off, I believe, and you're working a surgical oncology unit, and something you had an experience with a patient that clearly changed your life. Do you want to finish that story for us, please?
Yes, she came out of surgery, and when she returned to the floor, she cried in my arm, and it really, really broke my heart because she said, I will never ever square dance again. And what happened was that she developed a foot ulcer, and at that time she underwent a below knee amputation, and that was really difficult to watch her cry, and it broke my heart. I just felt that if this can happen to her, what can I do at that time, knowing that there's diabetes on both sides of the family? I wasn't diagnosed with diabetes at that time until I was 21. Um, I just felt that there should be something that we can do. And sorry.
No, that's okay.
Oh,
and and I didn't get into med school the first time around. I went to Roswell Park Cancer Institute and I started doing oncology research. And one of the things that they told me is don't get to know your patients, because I was dealing with T-cell leukemia, and I got to know my patients, and unfortunately, none of them survived.
no, because you're such a good person. Oh my goodness. You just felt for every single one of them.
I
Wow.
really did.
And they still impact you today. And it speaks volumes for your character and why we are so blessed. And every one of your patients is so blessed to have a touch point with you and have you in their lives. So
Yeah.
thank you for all you do.
And that really impacted me. I couldn't. I thought about reapplying to med school and doing MD, PhD, but after that experience with oncology, I'm just like, no, I definitely want to do podiatry because I felt I could save limb. It will affect people economically because we all know what happens when someone loses a limb, and the cost of what it does to them economically, to their family, and to their health and to their mental state. So I just felt podiatry was the right thing, and I really felt drawn to it. And so I was very fortunate that I got into the Ohio College of Podiatric Medicine.
Yeah, there was something that you could
Congratulations.
do, right?
Yeah.
Something you could control. And in saving the limbs, you're saving lives. And it probably was really empowering. How long were you practicing though, before you ended up being forced into a different career path? And what took you down a different career path?
You mean from podiatry to diabetes education? Uh,
Right there.
well, my second year of residency, someone ran a stop sign and hit our car and missed hitting me by 1 foot, and so I had a severe whiplash. But when you're in residency, you really didn't take time off to take care of yourself. You are more worried about the patients on the floor, and so I wasn't getting physical therapy like I should, or any of the care that I should. But around 2018 or so. I came out of residency, started practicing 2006. Then around 2018 or so, I start falling, and I didn't know why I was falling a lot. And I start developing worsening of my right foot where it's drop foot. So I went to see my favorite neurologist, Dr. Hughes, and he did MRI and found out the ligamentous flavum, which is in my cervical area, calcified and was starting to fray my spinal cord, and um, the that led to my first surgery at New York Columbia Presbyterian Hospital, with
So
Dr.
Gene,
Paul McCormick.
so Gene, that was serious enough where they needed, if they didn't do surgery, would you have become paralyzed? Is that a possibility or?
And that's what led to my second surgery, because my first surgery, even though the bones fused, I was still having problem, and we re-MRI'd and found that there was continuing to have stenosis from that. And the day they told me to go back for a second surgery, they were going to fuse two more vertebrae. So I'm now fused from
How
C.
old were you at the time?
Um, gosh, I'm 57 now, so I think that was around 51 or so.
Okay. So
Um,
very young.
yeah. Yes, the day they found COVID in New York was the day they told me I needed my second surgery. A week later, the office called and said, "We can't take you to surgery safely because of COVID." So they said, "You're only allowed to sit on your sofa. You could go to the bathroom. You could go to the kitchen. You're not allowed to do anything else. You're not allowed to do housework, nothing." So thank God for my husband who did everything. And by the time they took me to surgery, which I can't remember exactly, it's either 7 or 8 months later, the left
Wow.
side of my body was paralyzed in the sense that I can't really move my left arm. I was moving my left arm, holding it up like this. Um, and I could still walk, but it was with difficulty. So they took me back to surgery. Um,
So you were that tenuous that they said you basically need bed rest or seating rest, whatever.
yeah,
Wow. Okay. Holy cow. And this is all related to
to car
the
accident.
car accident. Jeez.
Yeah. And by the time I got discharged from my second surgery back home, bedbound for 3 months, my primary care, when I did follow up with my primary care post surgery, she said, "You can't feel your hands very well, and you can't really turn your neck very well. Your career as a podiatrist is over."
Wow. What went through your mind in that moment?
It was devastating.
Of course.
It was so devastating. And this is where I really want to let the audience know it's okay to have disappointments in life. But if you are feeling depressed, please get help, because um, I I was resistant to getting mental health help initially, but my primary care Dr. Jensen at that time talked me into it, and it really helped in trying to turn your life around to say, okay, this part of my life ended. The depression was really bad, so of course the diabetes got really bad. Um, but counseling helped. My best friend, who is a chef as well, is a diabetic educator and a PhD in nutrition. Um, by phone, she lives in California. Called my husband every day, control my diet, worked with me um, about my diet, and she taught me some the tricks that she used in working with her patients. And these are the same tricks that I'm using with my patients because you know what? I've gone seen diabetic educators before, but getting a handout, it's like, what am I supposed to do with this? I don't know what to do with this. But to actually have real tricks that are applicable can really make a difference in getting your diabetes under control. So I have to thank my best friend, my husband, for being there for me. Um, and my husband did take me to physical therapy. I didn't want home physical therapy because I felt um, being at a physical therapy place would be they will be more aggressive in trying to rehabilitate me. And I have to thank my husband. Like he helped me bathe, he helped me get dressed, he took me to PT and helped me walk with my walker. I mean, I'm really grateful to him.
And coming up next, right here on the Heart of Innovation, we'll have more with Dr. Jean Chen and that aha moment that led her to actually become a diabetic educator. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
That's Gene, thanks for sharing that. That obviously takes a lot of strength and vulnerability. We only have the next segment's only about 4 minutes, so
Yeah, I would love to get to
we
that
need a
aha
longer.
moment.
We need longer. Yes, we need longer podcasting time.
Yeah, but it'd be great. So the aha moment that led her to doing
30 seconds.
Is there
the
a
diabetic
specific aha moment?
education. Yeah, there was.
Oh, okay, gotcha.
With Dr. Manassas. And you can say his first name too, Doctor. I don't know what his first name is, but do that. And then what she's also doing now with the AHA at Collaborative and furthering awareness, looking to go to Capitol Hill to get testing for PAD patients sooner. All that in 4 minutes or less.
Okay, Kim. Sure. Okay, whatever you want, Kim.
1220.
Want us to rewrite the Bible too, real quick?
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
This is our last segment. We've only got a couple minutes left, and like they said in Shawshank Redemption, get busy living or get busy dying. And Gene, you obviously had to come to terms with the fact that you couldn't do what you were doing before as a podiatrist, but now you had an aha moment, I hear, that said, I guess I can do something else, and diabetic educator is what you chose to pursue, correct?
Correct. I was so depressed. My sugar was really out of control. And Dr. Manassas said to me, Jean, what can I do to help you get this back under control? And I thought for a second and I said, I want to be a diabetic educator because I don't want to waste my education. And I feel what I have learned as a podiatrist, plus what I have learned from my best friend, I could take this and help somebody else out. Because if I'm talking to a patient, I'm talking to myself to never give up. You just can't give up because life can either defeat you or you could defeat it. So that was the moment. And from then on, when I could walk again, came out of the walker. He paid for my transportation for every Monday for 7 months. I trained with him. I became his diabetic educator. And one day when I was taking my husband to see him at his Manhattan office about my husband's medical concerns, his diabetic educator quit. So he just said, "Are you ready?" I'm like, he said, "Are you ready? Take your first patient." And he hired me on the spot, and I've been with him 4 years now.
And what's been the most rewarding part about being a diabetic educator?
What I love the most is when patients are very early, like in pre-diabetes, I have a few of my patients, they reversed their pre-diabetes. I had a few that gone from early stage type 2 diabetes to pre-diabetes stage, including my husband. So I'm really proud of him that his last hemoglobin A1C is 4.7. We went from 5.7 to 4.7.
So you give, I mean, you give people hope, and I think we only have 2 minutes left, but that is a significant statement that you just made, because there's, I want to say 20 to 30 million pre-diabetics in this country, and they are just a couple of months away from being diabetic. So with help with people like you and a great physician, we can push this tide back and get people to, keep them out of diabetes. So awesome work. Thank you.
Oh yeah, I tell patients I'm on your side. I'm a diabetic and I don't want you to undergo the hardship I had, being scared, getting a stent in the heart and knowing I could possibly die the next minute. I don't want anybody to have complications because it is scary and it is it breaks my heart when people have to suffer so much.
Yeah, in the last, 30 seconds, to a minute here, this has become not just a job for you. This has truly become, you are mission driven and you are taking on awareness at a grander level with the American Heart Association PAD Collaborative. Diabetes is a huge risk factor for PAD. In the last few moments here, talk about what, if you could achieve anything in 2026, what would it be?
I would want a presidential executive order to recognize PAD as a threat to our safety, our health, and it's also a national security issue because if our nation's not healthy, then our country will be in trouble.
Let's get
Thank you so
RFK Jr.
much.
on this show. Let's do it. RFK Jr., we
Exactly.
want you.
Dr. Jean Chen, thank you for your courage. Thank you for sharing your story and all you do to save life and limb. And thank you everyone for joining us. If you want to see the after show, go to youtube.com/the @ the way to my
Been
heart.
listening to The Heart of Innovation with
I feel like, Jean, that, you talk about the whiplash. That was like a whiplash of information, like right there in the end that we could have spent an entire other hour talking about. But we're still
Yeah.
live for a few more minutes. So I was thinking for those, everyone's jumping in here in the live studio audience saying that was just an amazing show. You are such a force to be reckoned with. Would love to maybe start this after show and do a segment with Dr. John, if you wouldn't mind leading us in. You had such a great idea. It's Mental Wellness Awareness Month, and there's something that you want to know about patients who are going in, whether it's a leg catheterization or a heart catheterization, what is going through their minds in that moment. So go ahead and tell us, what do you want to know? And maybe Jean could jump in and share a little bit more.
Sure. No, I think when during the show, when Jean shared her vulnerability and the thoughts that she was having prior to undergoing the heart catheterization, it is something that I think about a lot because I do those procedures. I put stents in. We see folks when they're vulnerable and scared, but I've never asked the patient afterwards, like, gee, how did you feel when I was getting ready to, we were getting ready to do this? Because it has to go through your mind that, okay, number one, I'm sick. Number two, there could be some issues here. And if things go sideways, I could die. And I've often wondered what that must, what goes through your head. And then in Jean's situation, she's a doctor, so she has medical background, medical knowledge, more knowledge than most patients. So Jean, if you don't mind, just share, if you could, your thoughts around what my kind of verbal incontinence there, and how you approached or dealt with that vulnerability prior to having the procedure.
Especially when the cardiothoracic surgeon came in with a sandwich in his hands.
So this must have been this was an interventional cardiologist, right? Not a surgeon.
Yes.
Okay, so you did have it. Okay, so you said cardio, so it was actually interventional. I see.
Yes, my mistake. It was I see. Well,
No worries.
I
No, I'm not offended at all, Gene. Don't worry.
I thought it was really hilarious that he was eating, but I also recognize that it was around 12:30. So I much rather have him be steady in his hand, let him not be hungry so that he's not shaking his hand because I did surgeries before, right? As a
Yeah.
podiatrist, I've done surgery. So I'm just like, all right, fine, whatever. Just a little embarrassing. I'm uncovered. So I insisted they put a drape over me.
Of course. Well, no, because I'll ask the patient. I'm like, what kind of music do you want to listen to? And they're always like, well, what do you want to listen to? We want you to be. I said, I really don't care. And then, I will say, as I want you to share more, just so the audience can get a glimpse into the vulnerability and how a lot of none of this is under your control, frankly. But I will tell the patient because they ask, I say it's okay to be nervous, right? Because if you're not nervous, that makes me a little nervous. So I mean that's how I deal with it. But I mean you have to realize it's kind of like getting on a plane. I have no control. Like I hope this sucker takes off and lands, but I have no control over this. And you have to really just kind of acquiesce any control and just put it in God's hand or whoever's hands that you feel appropriate, right?
Oh, totally. I agree with you. When I was able to do surgeries as a podiatric surgeon, it was the same thing. Like if
Yeah.
I'm going to do bunion surgery or amputation, and due to osteomyelitis or ulcers or gangrene or whatever, I tell the patient I will pray with you if you want me to pray with you.
Mhm.
It is totally okay to be nervous because I would feel very uncomfortable, especially for elective surgery. If you're not nervous, I don't want to do surgery on you. So when the IC was eating outside, I don't know where he was, but what went through my mind when I realized all the potential possibilities, like, all right, I said the Lord's Prayer, and I just said, it's in your hands now. If you want me to be here, I will be here. If you want to take me home, it's totally up to you, Lord. But I do believe, um, I didn't tell you guys this before, but I had an anaphylaxis to penicillin when I was very young in Taiwan. And I was given a choice, like, do I want to continue to move on or do I want to come back? And I cried for my mommy and they let me come back to Earth. So I personally felt that it was not my time to go because I felt there's a mission for me to accomplish here on earth and I haven't accomplished it yet. But I told the Lord I'm in his hands.
Wow, that's amazing. And it's one of those moments, and it is a reality. And there is a lot of risk with these catheterizations, whether, with your leg or your heart, there can always be downstream emboli and someone could stroke during a leg procedure. But we had a patient that needed a leg procedure, went to a specific doctor, but while there discovered that she had something more serious going on in her heart, and that was more pressing. And she had a type of tissue disorder, connective tissue disorder. And when he went in to do her heart cath, the tissue, the artery was so frail, he just perforated just like that. The stent just went right through her artery,
Mhm.
and she died there on the table. And it seems that heart caths are done a lot more these days and a lot sooner, than they used to be done. And I just always want to reiterate the risk of going into these procedures, the importance of conservative therapy first, and also asking the right questions to your doctors and understanding the risks involved and asking the doctor, how are you going to mitigate these risks? Of course, as Dr. Phillips knows, you can't prepare for everything, but it is a fair question for Dr. Phillips to have asked about what is your mental state going into a procedure like this, because anything can happen. You would hope most of the time, 99% of the time, nothing's going to happen, but it can. And so, I thank you, Dr. Chen, for sharing your experience with that. We also have Douglas, who is here in our live studio audience, that knows very well about that experience in going in and having his life on the line with every procedure. He's part of the Zipper Club. He has apical hypertrophic cardiomyopathy and ended up with open heart, not knowing if he was going to come back. Douglas, do you want to unmute and share your experience?
The mental health side, yes, that's a big question because 3 days after my myectomy, my defibrillator went off 3 times in 10 minutes. And I do remember the third time it went off, telling the doctor, if it goes off again, just kill me because I have never experienced that before. And the part about, I think, Kim, is what listening to you is amazing, is for the next 3 days, I was just kind of left in the bed there, and the thoughts that went through my mind for the next 3 days were just amazing, and how I felt, and all the bells and whistles, and being attached to everything. And I remember Friday morning at 5:30 calling my brother and telling my brother, I can't do this no more. I have to have help. And so that mental health side of that, and being in a room with 12 other people at that time in ICU, and just being nobody really being there. So I maybe that, I hope that makes sense. But yeah,
No, it does. So
the
it's even
fear of
beyond. Go ahead,
my
Douglas.
defibrillator going off, and how that hurt, and the things that went through my mind about living and not living, and what am I doing wrong, what am I doing right, am I going to heaven, am I not going to heaven, I
Mhm.
need a cigarette, I want a beer, I want a steak, or all the stuff that goes through your mind when you're in that moment. So yes.
And so you're saying is it's not just going in, being on the table, it's literally the entire experience of being in the hospital and being left alone. And I know that hospitals are tapped out. I mean, they're short-staffed and they're doing the best they can, but it might be really helpful to have a psychologist or a counselor, someone who can come through the ward, be there prior to these procedures, be there while you're just sitting there alone, left to your own devices, and your thoughts are just spinning and spinning and taking you down multiple rabbit holes. To have someone there to have a conversation with
And
and
what's
help
the
you frame
the
things.
craziest thing was when my brother got there that Friday morning, he walked over and touched my hand. It was that one simple moment that I mean, it's just my brother, but it was that one moment that I felt everything was going to be okay. Just that one, that my brother reached over and he goes, "Hey, I'm here." And just that one simple moment made a difference.
Yep. And it could even be, the doctor. It could be that one moment, like Dr. John, you walking into that one patient who we're going to call the 2025 miracle of the year, the Christmas miracle, right?
Yeah.
Um, that moment where you walked in and you had that heart to heart, that literal come to Jesus moment with him,
Yeah, no,
that
yeah,
was
but
probably life changing.
it was, but like for me before when I was the only one that could make this decision at the time to attempt to save this person's life. And I kind of said, okay, God, what should I do? And, uh, you know, I guess I'm at a little bit of a loss for words to describe it more, but that's really how I felt. Cause I didn't feel like it was like, it felt weird to me to be able to decide, because I could have just said, okay, we're done and he's dead and that's it. No one would have batted an eyelash because they based on doing CPR and everything. So I just asked God, I'm like, what should I do here? And that's kind of that instinct. And then when he woke, fast forward to 10 days later, he's awake and we're talking. And that's when I just told him, I said, someday I will tell you what happened when I see you in the office. But until then, God has a plan for you. And now you need to figure out what that is. And the guy, he's 68 years old. So it's not like he's, 40, but still there's a
He's
reason.
young.
Yeah. The good Lord wants him here.
Definitely. So, it's really important. But Dr. John, in hearing, both Dr. Chen and Douglas's story, is there anything from your perspective that a hospital system can do in these moments where a patient is preparing for those procedures or is recovering following a procedure that, maybe some psychological, maybe there should be some time scheduled. I don't know if there's enough staff to go around. Or would you have any advice for nurses and doctors in being able to provide those powerful moments that could help take them from going down those rabbit holes and bring them back to the present and have hope again?
Um, from my perspective, I think even if you don't have enough medical staff, but like priests or ministers, they are constantly available in a hospital setting to be able to have them come to the floor and talk to you before you undergo procedure to offer prayers. I think that would be very helpful in comforting someone.
Yeah, and I think I agree 100%. And I don't try to push any religion or anything on patients. I often ask them, or I'll say, listen, I don't know if you believe in God or not, and I'm not here to judge you, but I do. And, but if you want, I'm happy to pray with you, or I've had a couple patients ask for that. I just think and I've said this before on the show, and I've learned this from listening to folks that call in and are frequent listeners, that as a physician, you have to remember that the person you are about to do a procedure on, whether it's surgery or stent or whatever, that's a human being. That's a son, daughter, mother, aunt, niece, whatever. And they have family that are worried about them. They're worried, and you can't take it too lightly. Although you have to be careful too. At least in my mind, there is a little bit of a dissociation there, because you can be paralyzed by the overanalysis of that, I think. And so it's difficult to walk that line sometimes, at least for me personally.
Yeah,
It definitely was for me doing surgeries and amputations. It was a difficult thing because I never forgot the first patient I did surgery on my own for transmetatarsal amputation for wet gangrene. As soon as they pushed the propofol for anesthesia, the patient went to cardiac arrest, and that was a very tough one.
Yeah, you just never know. It's one of these things like medicine, or there's just when you think you've seen it all, you'll never see it all. There's always a scenario that you just can't. You prepare for things and kind of in general, but you never see it all. And yes, 2 days ago I was helping a lady. She had critical limb ischemia, so she had an ulcer on her toe, and it was very painful. And we had a hard time kind of getting her to calm down. And obviously, we don't do our procedures on general anesthesia, so we have sedation. But there was only so much we could give her. So I said, what do you watch for TV? You try to distract people, right? And
Mhm.
she's like, oh, I love the Stranger Things. And I said, oh, I like that show too. Like we watched this, and it just had the season finale, or actually the show finale. And so we talked about that, and that kind of calmed her down a little bit. So I think it is trying to find something that you can connect with to that patient. You and the patient can connect, and then it makes it a little bit easier too.
That can really make that
Yeah.
difference. It's taking that moment. Remember, we had Dr. Robert, I think it was Robert McLafferty on, and he's a vascular surgeon out of the Northwest. And he was talking about how he used music and his passion for music and songwriting to actually connect with so many patients, whether it was in clinic or whether it was in the catheterization laboratory.
Yeah.
But it is taking that one moment. And that's why when my dad was on the verge of a heart attack and he went in for a catheterization, I was very clear that IC needed to take a moment with my dad and put a face to those arteries. And he did. And it made my dad feel so much better to have that one moment where he could shake that doctor's hand, that he could see him face to face. He needed that moment of connection that would give him comfort and give him hope. I always tell patients to make sure before you go into any procedure that you're in the right mindset, going in. And I know that's hard in an emergency situation, but if you can, don't go through with a procedure at all or with someone that you're not 100% confident in, because you can tell Dr. John, right? When someone is really, really nervous and they tense up, and it
Mhm.
does make it harder for you to get into those arteries and be effective in your treatment.
Yeah, no, we had a gentleman earlier in the week too that we were doing a procedure on. He was very anxious, and uh, you know, we do him under conscious sedation, so there's only so much you can give without having respiratory airway issues. Uh, and we were able to calm him down a little bit, but I'm very frank. I said, "Listen, sir, if you can't settle down here, we can't do this, because if you're moving around and we got big tubes coming out of your arteries, you're gonna have a problem." And it works out, but and Gene, you can probably attest to this. You get like a spidey sense, and when my spidey senses go off to be like, this isn't going to go well. I don't do the procedure. Like most of them are elective anyway. We can cancel and just reschedule. Obviously, the emergencies we have to do, but yeah, it's just kind of weird. But the spidey sense is real for me, at least.
It's real for me too. There are patients that I will not do surgeries on for elective surgeries. Just something tells me that this story isn't jiving up. I don't
Mhm.
feel comfortable.
Yeah, it's weird.
Yeah.
Like you just don't know why, but there's something there. There is something there, and it like for me at least, it's always worked out. So I just go with it. You just kind of build on it.
It was interesting that, Dr. James Antozana is a vascular surgeon in North Carolina. And he called me one day and he says, Kim, I have, a patient that's in your network, and I had to cancel. I got a bad feeling. She was in clinic today, and I just have a bad feeling about her. I could do it. I could open those arteries, but I still think it's going to be a poor outcome because her mind is not in the right place. And I said, you do you. And if I need to get her a second opinion, and if I need to get her some psychological support, we'll work on that. And within moments, this patient called me as well and said, oh my gosh, I'm so anxious and I don't know. And I don't know if I should do this procedure. I mean, she was going down some serious rabbit holes. And in
Uh-huh.
that moment, I was really appreciative that Dr. Antozana took a step back and said, yes, I could go in and do this procedure, but I don't see it being a positive outcome because of her mindset. And yes, she really didn't believe that anything was going to work to save her legs. Ultimately, we did get her some psychological support. And after a couple of months, actually, she started walking as medicine,
Great.
and she hasn't needed a procedure. Yay, which is awesome. But I love that what we talked about in our Heart of Innovation show today is that instinct driven medicine. And I would love to end this segment with that quote that you brought forth, because I think it's really appropriate and it's all about that mindset. And so I'll let you take us out.
You want my whose quote? Mine or Gene's?
Oh, the quote that you actually shared in the beginning of the Heart of Innovation show, your moment of
Oh, my
inspiration.
market. Hold on. Let me find it again here, folks. Let me find it again.
It was so powerful, and it seems
Yeah,
appropriate
I
to
mean
finish this out.
it's the Marcus Aurelius quote
Yeah.
of give me 1 second here. I lost my chat bot. Um, Marcus Aurelius, Roman Emperor. You have power over your mind, not outside events. Realize this, and you will find strength.
I love it.
Nice.
I love
A core
it.
tenet of Stoicism.
Okay, our one other segment that we're going to do here. So, for those who are watching this after show live on YouTube, we had some new guidelines that came out on food. So, Dr. John, you want to open us up, and then we'll let Dr. Jean Chen go ahead and give her perspective on these new guidelines. So, patients, especially with diabetes, have a direction or a way in which they can handle. Or put these into practice.
Yeah, so interested to hear from not only a physician but also a diabetic educator. The new FDA recommendations for the appropriate diet, and one of the things that I kind of focused on some of the changes was doubling protein intake, which I think is important. And it is hard to get the amount of protein that you need. I tell patients they should probably be getting about 1 gram of protein per pound. So, I mean, I'm 175 pounds, so 175 grams of protein is pretty tough. But to try to get it 0.8 of that or so, because the previous recommendation, I believe, was like maybe 0.5 or 0.6 per kilo, and now it's like 1 to 1.2 per kilogram. So that was one thing. And then, the other, I think there was a little bit, and Gene, correct me if I'm wrong, a push towards animal fats, a little bit more of animal fats. So that's okay. I'm a big oil, like olive oil person, and we've talked about that before. There was also recommendation on less alcohol, which is important, and then kind of staying away from processed foods, not trying to avoid eating anything that comes in a box, frankly. But those were my kind of takeaways. Gene, happy to hear, encouraged to hear your thoughts as well.
When I went through the new food pyramid, I was very happy in the sense that one, we need to increase the protein, and especially now we're using a lot of medications. That's GLP-1, which is like your Ozempic and your Mounjaro, the GLP-1 GIP medications. It's great. It helps with cardiovascular health as well as the renal health. But the thing is, with the weight loss, a lot of that muscle mass is being lost. So I've been telling the patients to increase their protein intake. So I'm very happy to see that we're doing that. However, I would caution is that make sure that protein is a lean sources of protein, not fatty sources, because that can also increase our insulin resistance. And again, I'm very happy with the fiber intake because fiber is your friend when it comes to diabetes management. And I would still continue personally. I have continued the ADA plating where half of your plate is non-starchy vegetables, lean protein for quarter of the plate. And the starch is great because you're decreasing the amount of starch, and you do need some of it for macronutrients, but as we know, starch increases your blood sugar. So I like what I see, and I always been telling patients to avoid processed food as much as possible because it strips the vitamins, the minerals, and they're just adding it back in. It's not natural. You're better off eating whole food. So I'm very happy with that. And for oils, I stay away from seed oils like your corn oil, vegetable oil because they're inflammatory. So I am okay. I like avocado oil, olive oil, and just a little bit of tallow. Not tremendous, but I haven't done enough
But the
research.
natural
Do you
tallow,
take?
right?
Yeah,
Natural
yeah.
tallow,
Yeah.
not GMO,
Right. Go render your own
manufactured.
fat, right, from the grass fat.
And that's,
Do you,
also
do you,
the
do
same
you-
issue with dairy, and they have dairy included, and I'm concerned about the genetically modified rennet that is in our cheeses versus those in Europe. So I always tell our patients, if you're going to eat cheese, always choose an aged cheese and make sure it's from Europe because they don't use a genetically modified rennet to make the cheese.
Yes, I agree with that. I was recently researching into that, and I totally agree with you, Kim.
And what
do you have
about
any
milk? Oh,
comments?
go.
Oh, sorry, real quick comments on the type, protein source, whether it's animal based or plant based. Does it matter to you?
For me, I look at people's genetics and what they grew up with because it's going to
Okay.
be very hard to change what they're used to. But we do know that more of a vegetarian style diet based on the China study and based on what I have read, like what Dr. Madugo did, is that more fiber in these vegetarian diets seems to help with the better diabetes control and decreasing insulin resistance.
Mm-hmm.
But fiber meaning vegetables. We're not talking, they put grains all the way at the bottom, and it used to be much higher, is my understanding. But it's getting those green leafy vegetables in there as much as you can. That should be the fiber that you should be
Oh
eating.
yes, yes, yes. I tell my patients that I'm Chinese, so if you tell me not to have fried rice, I swear I punch you.
Yeah.
But the way that we do our fried rice is that like maybe just only a quarter cup of rice, and we would put it in the refrigerator overnight to form resistant starch, and then the rest of the three-fourth cup would be all sorts of vegetables. So that's how we mix it in. So we're kind of like having a modified fried rice, but with lots of vegetables so that I can still have it.
Good for
What do
you.
you think about? I get the Jolly Green Giant frozen riced cauliflower mixed with, and I mix it with peas and carrots and chopped up asparagus, and I put it in my pan, saute it, and get it a little bit crispy as well, and then I put in a scrambled egg in there to make my own fried rice. Is that something that you desire as well? Is that an option for the diabetic patients versus regular rice?
Well, I think it's a good option, especially if you are in an area where food desert is it's difficult to get fresh vegetables. So not only that, we do know that frozen vegetables that you take it off the field, and a lot of them are frozen right away. So you're really retaining that nutrient. So I don't have a problem with that. I would just for a diabetic, I'd be more cautious about corn and peas. You could have a little bit. It's again in moderation, but not a lot because those are starchy and they will raise your blood sugar. But again, it all depends on your body chemistry. For example, oh, there are people who say, oh, you're a diabetic, you can't have a banana. But there's a patient that came to our practice at Endocrine Associates, West Village, and our chief diabetic educator, the patient ate a banana in front of her, and 2 hours later, see, it didn't spike my blood sugar. So everybody is different. So you have to use your blood sugar to learn what your body tolerates and don't tolerate.
So you're a big proponent of the continuing glucose monitors, right? For the that you
Oh,
wear. I mean, for everybody, right? Get to
I
know your body.
I think all diabetics should have that. I honestly think that. And it makes me so furious with the insurance. Oh, patient doesn't have history of low blood sugar. Oh, patient's not on insulin. They shouldn't be given a glucose monitor. And I'm just thinking, but it is such a great behavioral modification. Like if I purposely set my sensor because I'm on insulin pump, I purposely set it where my sensor will give me an alarm when it's 150 because I'm like, uh-oh, it's starting to spike. I'll get up and I'll walk in place for like 5-10 minutes so that I'm bringing that sugar down. It is so great in behavioral modification.
Can you speak to fruit intake with insulin resistance with this new food pyramid? Our producer Joshua is asking.
Oh, um, well, insulin resistant has to be related to like your visceral fat, and also if you eat too much fat, I call it like it's think of a lock in the door, okay? And like insulin resistance is that fat that you're eating clogging up that lock. So now the insulin can't get inside the cell and bring the glucose inside the cell. So you don't want to overeat on the fat. I mean, we do need a little bit for brain health, right? Because cell membranes have cholesterol, it has a little bit of fatty acids. You need a little bit, but you don't want to overdo it. So I would just go with the healthy fats, the ones that are not inflammatory, because if you're eating foods that are inflammatory, that's going to increase your insulin resistance.
And what about fruit? That's another
I
one.
I like fruits. I don't have a problem with people eating fruits, but again, everything's in moderation. And I prefer fruits over juice because, like for example, if you're eating fruit, you actually have fiber, right? And so that fiber is slowing down the absorption of sugar. Versus if you're drinking juice, then there's no fiber. That's all been removed, so you're not slowing the absorption of sugar. And sometimes like a glass of juice could be like, for example, orange juice, it could be like 4 or 6 oranges that you press into it, and that's a lot of sugar that you're
Mhm.
just pouring into your body, and that will spike your blood sugar. And I would recommend that people choose low glycemic fruits. Not that you can't have things like mango that you like. It's like mango can really personally spike my blood sugar, so I only eat a quarter of it. You have it just in moderation, but I prefer people go with berries and stone fruits like apricot, peaches. Those stone fruits and the berries are lower in glycemic index.
Fantastic. And what do you think about dairy? Aside from the cheese, I know milk. I'm not the biggest fan of milk. I make my own, and I know it's higher calorie, but I do make my own walnut milk at home. And that is my replacement. But also, I don't drink as much milk. I just use that for the smoothies. I just don't drink any sort of milk. I use, coconut water and tea and all that kind of thing. But dairy is up there as at the top of the pyramid now.
Yeah, I haven't had a conversation yet. I sent the new pyramid out to our diabetic educators who are dietitians. I'm waiting to get a response back from them about what they think about it. Personally, for the past few years, I don't drink milk often because I'm lactose intolerant, but I do buy whole milk, and we do limit the amount of whole milk. Like my husband will only have a glass and he wouldn't have more than that. Just because like with weight control, we don't want to overconsume on calories. And there are some studies that seems to suggest that lower fat may not be all that healthy for you, but I just don't know enough about it, so I don't really comment on it. When it comes to like specific nutrition questions, me not being a dietitian, I tend to refer my patients to the dietitians to go over that.
Yeah.
Any cautions before we close out here? Any cautions for those that are looking at this new pyramid and saying, ha ha ha, I can now eat all the meat. I can eat all the fat that I want.
I wouldn't do that.
Very simple. Yes.
Period.
No, I
Period.
mean, again, like we've talked about all things in moderation, okay, for me at least. Um, and the big ones, get your protein in, get your vegetables in, avoid processed foods. But I'm a realist too, and I tell patients, listen, I try to do 95, 5, 90, 10. So yeah, I'm gonna have a piece of pizza every once in a while, and I'm gonna have what I like. Life is too short, in my opinion, to if you want to eat something on occasion, eat it. And my other caveat, if you make it to 85, eat whatever the hell you want.
I have to agree with that. I tell my patients 90% good, 10% bad, because you know what, we're all humans, and you restrict yourself, you're going to binge on it. So you end up feeling terrible about yourself, like, oh, I failed my diet, I'm a bad person. No, it has nothing to do with that. It just learn from that and just go, I can make a better choice next time, or how can I change it the next time you encounter the situation. Like, I wouldn't be eating a whole piece of cake if it's my birthday, and not all diabetics live to my age 57 or older. I'm going to celebrate, but I'm going to just say, hey, Jack, who is my husband, can we split this piece of cake?
Sure.
Mhm.
Yeah.
No
Yeah.
need to splurge. But I know my dad is 83, and at first, when he was diagnosed with heart disease, and he did have pre-diabetes, and he didn't want to make those changes, and it was really hard on him. But at 83, you would say, right, as Dr. John did, eat whatever you want. But because we were able to make some changes, he could have his martini that he likes at night. But the dietitian said, make sure if you are going to have, and that's your non negotiable. And I loved her approach, which was, okay, Bill, what are your non-negotiables? And she wrote them down, and she's like, okay, let's work around them. You have the martini, you need to have a handful of walnuts, almonds, and cashews along with that. If you want, bread because you enjoy sandwiches and you enjoy things, okay, let's do a gluten-free bread or a sprouted wheat bread, and let's limit to one sandwich a week, and you can have your toast on the weekends. You can make these compromises, but he's also found great alternatives that he now loves and he now craves. When we were on the cruise, we discovered that we could love, 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 love eggplant parmesan, which was made with only the sauce, the eggplant, a healthy oil, and a sprinkling of Parmesan cheese on top. So you can modify the things that you love so that you can enjoy them and maybe even discover something new. So thank you so much, Dr. Jean Chen, for joining us. We really appreciate you. And thank you, John, for always donating your
pleasure.
time. And oops, did you hear I just called you John? Oh my
I love
goodness.
it. Thank you.
I knew you.
So formal.
Dude, I missed that
I love it.
one.
I love it. Thank you.
Thanks everyone for joining us.
Thank
If you're
you.
watching, Dr. Jean Chen is actually now in our Facebook group. If you have diabetes questions, make sure to join our Facebook group, padsupportgroup.org, and tag her in your posts and in your comments. And she is fantastic at getting very quickly to answering your questions. But thanks everyone for joining us. Don't forget to like
Thanks,
this
Jean.
video.
Thank you, everyone. Thank you.
Subscribe to our channel so more people
Love
see
it.
this. Have a great
Cheers.
weekend, everyone.
Take care. Bye-bye.
Bye-bye.